Welcome to Hello Pharmacology. Today in this session you're going to learn about parenteral injection. Coming to the learning objectives, at the end of the session you should be able to answer following things, that is, what is parenteral injection, what are the advantages and disadvantages, and major routes of administration. So coming to the parenteral injection, these are the drugs which are not given via the GI tract. So the absorption will not take place through the gastrointestinal tract. So next, moving on to the what are the advantages of parenteral injection. So they are more rapid in action, they have got extensive action, the actions are predictable in nature, they can be used in case of emergency conditions, unlike oral route which cannot be used. It can be used in unconscious patient as well as uncooperative patients, and also in patients who are unable to retain and take the drug via mouth. And the seventh point is the effective dose is delivered more accurately to a precise dose. So effective dose will be delivered more accurate to a precise dose. So the 8th point will be this route is suitable for loading dose of medications prior to initiation of oral maintenance dosing. Example is Digoxin. Next, moving on to the disadvantages of parenteral injection. So the disadvantages are it requires aseptic precautions to be maintained. It can cause pain at the site of injection, and self-administration is difficult if the patient needs to administer these kind of drug on their own. So the major routes of parenteral administration are intravenous, subcutaneous, and intramuscular route. So next, moving on to some important features of parenteral administration. The absorption from subcutaneous and intramuscular sites occurs by mainly simple diffusion along the concentration gradient from drug depot to plasma. So to understand this, you can see the diagram showing subcutaneous administration, where drug is administered into the subcutaneous tissue and drug gets deposited in the subcutaneous tissue, and it should be administered at an angle of 45 degrees. So the absorption here takes place mainly by simple diffusion. And one more diagram which shows the intramuscular route of administration, where drug will be injected into the muscles at an angle of 90 degrees. So here you can see drug is deposited in the muscle and it is injected at an angle of 90 degrees to the skin. So don't forget that subcutaneous route of administration and intramuscular route of administration, the absorption is mainly through simple diffusion. So what are the rate limiting factors which governs the absorption? One is the area and another is the solubility of the substance and the interstitial fluid. Area means area of the absorbing capillary membranes. So it is the drug which gets absorbed into the capillaries depending upon the area available for the absorption. Here the surface area is the area of the capillary membrane. Next comes the solubility, where drugs will be dissolved into the plasma as well as before dissolving it gets dissolved in the interstitial fluid. So the large aqueous channels are present in the endothelial layers, which account for the indiscriminate diffusion of molecules regardless of their lipid solubility. Means regardless of their lipid solubility or insolubility, these channel helps in the diffusion of the molecules regardless of lipid solubility. So this is the endothelial layer, and these are the molecules which will be entering into the vascular endothelium with the help of the aqueous channel. So these are the aqueous channels, helps in the transfer of molecules into the vascular endothelium regardless of the lipid solubility. So next is the large molecules, like example proteins slowly gain access to the circulation by way of lymphatic channels. So the drugs which are administered into the muscles, that is the large molecules, example protein, get deposited in the muscles. In the muscle, deposited drug diffuses into the lymphatic with the help of simple diffusion. From the lymphatic, the drug is carried to the capillaries. So large molecules enter into the capillaries from the lymphatic vessels and enters into the systemic circulation and get distributed to the rest of the body. So the drugs which are administered into the systemic circulation by any route, excluding the intra-arterial route, are subject to possible first pass elimination in the lung prior to distribution to the rest of the body. So the lung here will serve as a filter for particulate matter that may be given intravenously and provide a route of elimination for volatile substances. So coming to the learning objectives again, I hope you have understood what is parenteral injection, what are the advantages, disadvantages, and the major routes of parenteral administration. So thank you. For more updates, please like us and subscribe to I Love Pharmacology, and